Hey, it's Dr. Chad here. I want to welcome you to your doctor's report, which is your most important appointment here at our office. This is the appointment where we're going to go over everything from A to Z as far as what it's going to take to help you to be healthy through principled chiropractic care. Many people out there don't know really what chiropractic care is. So after your first visit, hopefully you understand that it's not how you feel, but it's how you function. And so the reason why we say that is if you look at all the healthcare statistics, you look at the United States, we're one of the worst countries in the world as far as how healthy we are and how long we live. And the reason for that is we do everything in our healthcare system by how we feel. We base it off of symptoms. And so if you look at all the nerves in your body, what percentage of the nerves in your body are dedicated to how you feel? It's only 10%. So nobody wants to think 100%, but it's only 10% of the nerves in your body dedicated to how you feel. So what's really important for you to understand is that we are focusing on function. And the way that your body is created is that you started out as one cell, and that cell divided and divided and divided. And the first thing created was your brain and your spinal cord. And in our office, we have a very important thing that we go by, and that's the above, down, inside out approach to health, which is what chiropractic's main focus is. We don't try to make you feel better. Our goal is to make sure that that function is happening at 100%. If that is the case, your body will be able to adapt and to heal the way it's created to. So if you understand how your body is created, you'll understand how we can actually help you function. And chiropractic is the only profession in the world that focuses on how your body heals from the inside out. Nothing in your body heals from the outside in. So healthcare, the reason why in healthcare we are so bad in the United States is because we keep trying to cover up symptoms. So a question that I would ask you, would you ever go on a road trip with a check engine light on your car, put a piece of duct tape over it and say, we're good to go on this trip? Of course not. You would never do that because you know that over the course of the time, that trip, you're going to have potentially an issue with your engine. So the goal of your first appointment was to figure out exactly where your dysfunction was happening in your body so that today we can go through step by step how we're going to be able to serve you and help your body function better. And when we look at healthcare, when we talk about symptoms, the top two causes of death in the United States, heart disease and cancer. I know most everyone watching this video will know someone that has suffered from that. You can have stage 4 cancer and have no symptoms. You can have a heart attack today and before that have no symptoms, have perfect blood work, have a perfect EKG, and still have a heart attack. And sometimes the first symptom is a heart attack that creates death. So when we talk about symptoms, that is the last thing that will show up. Research tells us it takes about 40% pressure on a nerve before you ever feel the first symptom. So it takes a lot of pressure and a lot of stress on your body before you actually end up producing a symptom, especially when only 10% of your nerves are dedicated to how you feel. So we're heavily focusing on your function to make sure that we can serve you and produce the best quality care that you hopefully want for you and your family. So we're next to this chart because this chart can illustrate the most important example of why chiropractic is important. And we don't have to look too far back, but we can look at Christopher Reeve. He was a very famous actor, played Superman. He had a very traumatic injury to his neck that dislocated the first bone of your neck. It's called the atlas. That surrounds your brainstem. The brainstem is what, when sperm and egg came together and it created you, that was the first thing created, and it controls everything that you don't think about. Right now your heart's beating, your lungs are breathing, your stomach is digesting food right now, and you don't have to ever think about that. That is all controlled by this brainstem. When Christopher Reeve had a dislocation, he had a trauma at the atlas, he was paralyzed from the neck down, but he also had to have a machine to breathe for him called a respirator 24/7. He had to have a pacemaker installed into his heart to help it regulate the heart rate. He had to have digestive enzymes for his stomach, from his pancreas, and from his liver. He had to have a colostomy bag installed into his large intestine because he couldn't function normally. He wouldn't be able to have bowel movements because of that severe trauma to his brainstem. So the brainstem actually controls everything in your thoracic and your abdominal cavity without you ever having to think about it. When we look at the atlas, that is literally the on and off switch to every part of your body. And so when you follow the nerve from here and all of these organs, that is why we say that this is the most important area of your spine. So when you had your evals, your nerve, your muscle assessment, or posture, if on your posture assessment your head was like this, Well, most of you are going to be at a job or on your phone or watching the TV like this all the time. And so that abnormal posture will create abnormal function, not to the severity of Christopher Reeve, but that severity of dysfunction gets worse the longer that tension and stress is on that upper neck. So when we go over this nerve pressure up here in the upper neck, if you're having headaches or sinus issues or dizziness or you're having jaw problems, all of that is going to stem from that atlas. But then everything else below the atlas can also be having issues. So if you ever looked at your posture and your head is this way, your shoulder is going to follow, your pelvis is going to follow. So that trauma or irritation to that upper neck can affect every other part of your spine. And so it all starts here because that's where life started. And so for many of you, your first adjustment is going to be on the atlas because that's what is controlling so many parts of your body that you don't ever have to consciously think about. And so with Christopher Reeve, he actually died of the common cold. Well, the common cold killed him because his immune system was so weak that the immune system is regulated by that same area of your brainstem. And so because of that, he had a common cold that turned into a pneumonia that killed him. And so he took antibiotics and antivirals and all these medications to try to treat the symptom, but his immune system was so weak he wasn't able to overcome it. So for most people, they don't realize that if you're the most stressed out person that you know, then you're going to get sick more often than someone that maybe isn't as stressed as often. The number one things that cause disease in our body is stress. And where does stress attack our body first? What do you think? It's your nervous system. Look well to the spine for the cause of all disease. And so in chiropractic, we own that. We know that our focus, our specialty, is making sure that the function between the brain and the body is at 100%. So next we're going to get into your x-rays specifically in your neck that can explain why this issue can be going on in your spine. Okay, so when we're going over x-rays, this is probably the most important thing that we do in our office. So when we're looking at your spine, we never want to go in there and start adjusting or giving you chiropractic care without seeing exactly what's going on with your x-rays. When we look at a side view of an x-ray, there are rules that we talk about as far as what we need to see and what we don't want to see. The question is, should we have a curve or should we not have a curve when we look at the spine from the side? So from your tour, you should know that we are supposed to have this beautiful 30-degree curve, banana-shaped curve in your neck. So that's ear directly over the shoulder. That's why we took your postural assessment on your initial visit. When we take x-rays to see, based on this abnormal posture, do you have structural problems because of abnormal posture? So the first thing is, do you have this curve or do you not have a curve? That's really important because that's your God-given shock absorber. I don't know if you mountain bike at all, but you would never take a road bike on a mountain bike course because you need those shock absorbers. The next thing is we want to see equal disc spacing between the bones. So whether we're looking at the side view of your neck, which is what this is, or if we see a side view of your low back, we want to be able to see that every disc is exactly the same thickness. If it's not, we'll talk about that in a minute, but that would be abnormal. That would mean that's where your body is getting beat up, wear and tear, stress-wise. So on this initial x-ray that we took of Stephanie, there's a lot of things that we're going to go over, but the biggest is you can see that the curve is actually going in this direction. So it's not that hard to understand that if you're on your phone or if you're working at a computer or maybe you work with kids and your head's like this all the time, some of the moms out there, that's what gets and creates that posture. This can happen from a car accident and some other traumas, but most of the time, this is from repetitive things that we do every single day. That is abnormal, but over time, if we start seeing the disc spaces, so follow along, if you see these discs, these two are normal, they're the same thickness, and then these two are way smaller than they should be. And at that exact moment, we say that's degenerative disc disease or spinal arthritis. So if you look at an orthopedic textbook, how many years do you think it takes for a wear and tear or an irritation to a joint? How many years do you think it takes for that to show up on an x-ray? You think it's 5, 10, or 20? Well, the research says it's 10 to 15 years is how long it takes of irritation and wear and tear on a joint before it ever shows up on an x-ray. So you may have come into our office with a pain or a discomfort that's been a week or a month or maybe a year, but then we look at your x-rays and you have significant degeneration. Well, that tells me this isn't a month problem. This is years, and sometimes people it's decades, because this, according to medicine, is a lot longer problem than what most people are considering. And what's amazing about the body is it's been trying to heal and adapt to that inflammation for a long time, but over the course of time your body can only do so much, and then it produces the symptom, and then now your body is telling you you need to take action and do something for that degeneration. So when we see that degeneration, there's actually the beginning of growths on the front of that bone. So on your x-rays, if you have degeneration, you want to look and see if there's this extra bone growth, and that's actually a bone spur. And the research on that says that can take another 10 or 15 years for a bone spur to develop. So for many of you, this problem that you have has been there a lot longer than you think, and the x-rays tell me exactly how long that problem's been there. So please understand, when we see this x-ray, to get from here to here, that didn't take a week or a month. That took time and repetition. And that's the second most important thing about our office after the above, down, inside, and out philosophy is that healing takes time and repetition. They say Rome wasn't built in a day. Well, healing doesn't happen in a day. It has taken a lot of time for your body to get into this position, so it's going to take that repetition to actually correct the spine. Have you ever had braces before? You would never say to your orthodontist, I know you said 2 years, I want you to fix it in 2 months. They would literally look at you and laugh, because it's not possible to correct that much structural damage in 2 months. So when we look at your x-rays and when we go over our recommendations, you're going to see that time and repetition aspect is the most critical part of your care. Just like when you work out, you can't just go work out once or twice and expect to have a totally different looking body or to be in really good shape. That takes time and repetition. And chiropractic care, the care that we provide called corrective care, is exactly like that. All right, so now we're going to look at the other view of the x-ray. So you had 2 side view x-rays. Remember the rules. We want to see that beautiful curve, and we want to see that there's no disc degeneration or bone spurs growing there. And the other x-rays that you're going to see is actually a front to back view, whether it's in your lumbar spine, your low back, or it's of your cervical spine of your neck. And that's the one that you had to open your mouth really wide. You probably thought that was weird, but there's a really important reason why we did that. But on the front to back view, we never want to see what we're seeing on this x-ray here, and you probably know what this is. It's called a scoliosis. When you were a kid, if you ever had a scoliosis, the doctor, there's only 2 things they can do. One is surgery, which surgery is only if it's a severe 40 or 60 degree scoliosis. The other option is they'll brace you, and with bracing it, the research shows it doesn't improve the scoliosis, it just prevents it from getting worse. And so the goal of what we try to do is to not ever just leave anything like it was. You would never go to the dentist and they say, you have a cavity, just work really hard the next 6 months to a year and you can actually make that cavity go away. No, that has to be fixed. There has to be something that intervenes to correct that. So with the scoliosis, this lady fell out of a treehouse, landed on her left hip. And that's why her left hip is significantly lower than her right. And you can just imagine with that scoliosis going to the left, that is why she's having severe low back, severe sciatic numbness and tingling down her leg. And so the reason why we give everyone this nerve chart is because you can see that the nerves in the low back, if you had to guess, where do you think those nerves also go? They go to the digestive organs and they go to the reproductive organs. Well, after this fall, this girl was about 15, 16 years old when she fell. She started noticing 30 to 60 days after that, her menstrual cycle went to 60 days to 90 days. And then she had a condition called amenorrhea, which means that she couldn't have a menstrual cycle without having to take some significant medications. Well, she came into our office in her 60s and was never able to have kids because of this severe trauma in her low back. And yes, she had low back pain, she had sciatic pain, she had severe knee and ankle pain. But what's more important, the musculoskeletal low back and hip pain, sciatic pain, or the function of your organs, whether we talk about those reproductive organs in the pelvis or the digestive organs like the large intestine. That's a silly question, but nobody ever thinks about, oh, my spine can actually create significant dysfunction with my organs. I had a gentleman that comes in from King Soopers that had a severe scoliosis just like this. And he also had prostatitis, which is swelling or inflammation of the prostate. I can't tell you how many men have had issues like that have been helped tremendously with chiropractic care. The one thing they had in common besides low back pain is a severe scoliosis. And I've never seen a female that had severe irregular menstrual cycles or maybe even ovarian cysts or fibrosis of the uterus that didn't have some sort of severe scoliosis in their low back. So when we're looking at the structure of your low back, we want to see that should be perfectly straight up and down. There should be no deviations left or right. And so the pelvis should be perfectly balanced. We shouldn't see left or right higher than the other. Because of scoliosis in the low back, we've already discussed what it can cause, but in the mid back, those nerves actually go to your heart and your lungs. So when we talk about asthma or gastric reflux or high blood pressure, the nerves in these areas go to those organs, and that can create the issues that most people don't even realize can be stemming from issues in their spine. Because that direct structural change, it's kind of like if you know an engineer, if you build something properly, it will function properly. And if your structure in your spine is not where it should be, you can't expect to have proper function. So we keep saying this over and over again, is that proper structure will equal proper function. So when you look at your x-rays, it's imperative for you to understand that if you have any of these asymmetries or things going on in your spine, this isn't it's not a death sentence. This is actually, we found the cause of your problem. We want to make sure we know 100% where the cause of the issue that you're having is stemming from. And for most of you, it's going to be stemming from your spine. And our job is to correct that with specific scientific chiropractic adjustments. All right, so now my favorite part of the whole discussion here is we talk about cadavers. When we first opened this report, I talked about how 10% of the nerves in your body are dedicated to how you feel, and 90% of the nerves in your body are dedicated to how you function. So what we look at is, okay, well, how does what we do affect the nerves in the body? So you have these handouts in your clipboard that are going to walk you through these two pictures, but this is two different cadavers sliced right down the middle, and it's going to explain the technique that we use, because the technique that we used is actually invented by a medical doctor who loves chiropractic. He just didn't like the application of twisting and popping and cracking to create the better feeling in the body. He wanted to make sure that from a neurological standpoint, we were changing the way the nerves were functioning and doing that as gently as possible. So we'll talk about that in just a second. But this is my favorite research article with chiropractic. Dr. Windsor was a medical doctor in Pennsylvania. He had so many patients that came to him that were seeing this chiropractor in their community and came back to everything from fibromyalgia to migraine headaches to irritable bowel syndrome, high blood pressure. I mean, you could list the diseases, but they went to this chiropractor, they came back and they were totally corrected. They were healed of it. This doctor verified all of that. And he said, well, this doesn't make any sense, because like you probably thought, chiropractic only helps with two things, neck and back pain. But he actually studied over 200 cadavers. So 10, 15 years of his life dedicated to researching cadavers. And he found the easiest example of this is heart disease. That's the #1 killer in the United States. So he would trace the organ of what that person died from. So if it was heart disease, he would trace the nerve from that organ back to the spine. And in 100% of the time, what do you think he found? That's right, he found severe misalignment in the spine, creating degeneration in the discs. And actually the worst thing about that is the longer that process is there, it atrophies the nerve. If you don't know what atrophy means, the nerve is supposed to be this big, and over the course of time, it's gotten smaller. So as a result of all of this nerve pressure over time and over repetition of having severe nerve pressure and misalignments in their spine, that shut down the flow of life to the heart. And he found that not just in the heart, but 100% of the cases, if that was colon cancer, he would trace the colon back to the spine. If it was thyroid cancer, from the thyroid back to the spine, every single case, there was a direct correlation to what that person died from, tracing it right back to the spine. And that's why it's really important for you to understand what we're trying to go over, is that this isn't about how you're feeling, this is about how your body is functioning. And so the other picture here is this is two different cadavers sliced right in the middle. And we're illustrating that, we want to see that beautiful curve in your spine. We don't want to see a straight up and down curvature, because without that curvature, you're going to have this significant tension and torque going on in the spine. And so if you know anything about musical instruments, a guitar is a great example, but I have my spine here, imagine this is a guitar string. It's going to be anchored at one end and at the other end. If that string isn't playing the right note, you don't just get in there and force it to play the right note. You go in there and you very gently and very specifically try to release tension to allow that string to play the right note. Well, your nervous system, specifically your spinal cord and your nerves, are the same way. They are anchored in the actual spinal canal. So if your spinal cord is traveling through the bones, it's anchored by all of these ligaments that hold that spinal cord in place. As the nerve comes out in between the bones, it's anchored by a ligament so that that nerve doesn't get pulled, or have you ever had a stinger before where lightning shooting pain goes down your arm or your leg? That's what would happen if it wasn't anchored into the bone there by these ligaments. So when we look at this picture, there's actual literal kinks on that ligament, and so that's where that flow of life from above down, inside and out is actually interfered with, creating that lack of information going to the body. And that's the way your body heals, is through that spinal cord. So that kink is what interferes with that flow of life, and that's where our adjustments come into play. So our adjustment is the only FDA approved technique in chiropractic. It's called torque release. So when you're getting adjusted today, we're going to be using an instrument. It looks very similar to this, but when you're getting adjusted, we don't go in there and randomly adjust. I mean, if you had to ask yourself, if I pop and crack a joint over and over and over again, does that make my joint more stable or unstable? I think everyone would say it's unstable. So the last thing we want to do is randomly go in there and twist and pop and crack as many bones as we can. And high five, that was amazing. What we want to do is be gentle, specific, and scientific to give you the most neurological adjustment that you can possibly receive. So the adjustment is very simple. We find the bone that's out of alignment. We put the instrument on the bone. The instrument actually torques when it delivers the adjustment, and what that is doing is it's releasing the kink on the actual spinal cord or on the nerve itself. And so what all the research is showing is that, if you had direct pressure on a nerve from the bone or the disc putting pressure on the nerve, which I know is how chiropractic has been explained to some of you, if that was the case, you wouldn't be able to sit still. You wouldn't be able to lay down. You wouldn't be able to move. There would be so much pain with that. This is the reason that we adjust people in a gentle way, is because it gets better results and your body's going to relax and it's going to receive that adjustment way better than trying to forcefully adjust all those different places. So the biggest and most important part of our office is just the amazing team that we have, but also we all have a story in relation to chiropractic care. Every single one of our team members has been a patient here first, and that's including myself. Like I said earlier, I played football in college, but my issue started at birth. When I was born via C-section, and so the research shows that babies that are born via C-section, the doctors are trained to grab the baby by the head, and they pull the baby out and they twist 180 degrees. And by pulling on the baby's head, the research is showing that's equivalent to a 30 to 40 mile an hour whiplash injury right at birth on a newborn baby's neck. So I don't know if you've ever been in a car accident before, but that immense amount of inflammation and tension that's in your body after that. Well, a baby isn't going to explain to you their neck or their back hurts, even all the way up until teenage years. Teenagers don't have that pain receptor of sitting postural discomfort until they're around 13, 14 years old. So from birth until 12 or 13, they don't have that sensation of, oh, I'm tight or I'm fidgety, my posture is really creating this pain. What do kids explain? They explain, oh, my ear hurts or my stomach hurts, or maybe they have leg pains like growing pains. But when I was a baby, from the day I was born, I never breastfed well. I spit up all the time. I was severely colicky baby. When I was around 2 years old, I had ear infections and strep throat almost every month, if not every couple of weeks, and was going to the doctor all the time. And people just never think about the first ever trauma that you may have had was the birthing process. Even if your birth was normal or if your child's birth was normal, that is a significant amount of tension on that neck. And so from 13 years old, when I started feeling my neck pain and my headache starting to happen, all the way until my senior year of college of playing football, I had headaches and neck pain. I had sinus infections all the time. I was taking sinus medication. I was shooting Afrin up my nose every day, taking pain pills, and at some point muscle relaxers daily, just to get through my day. And that was what was explained to me as what I had to do to be able to be normal or to function properly. And it wasn't until my senior year of college that I found a chiropractor that explained to me, well, how is that going for you? Doing the same thing over and over again and expecting different results. And I was like, well, that obviously isn't doing anything, because literally if I went one day without taking it, I would have the worst headache of my life. So when I actually started seeing the chiropractor, he took x-rays of my neck and he said, well, you have the neck of a 60-year-old. And I was 21 at the time. What do you mean by that? And he said, well, how long are you designed to live? And I was like, I don't know, 70 or 80. Well, the average age in the United States is 74 for females, 72 for males. But he said, well, how long are you designed to live? And he said, well, the Bible says 120. And he said, maybe you don't want to live to 120 years old, but have you heard of Harvard University? And I was like, well, yeah. I was a biology major, and Harvard University is one of the most respected universities in the world. They've mapped out all of our genes and have found that, yes, like genetically, we're designed to live to be at least 110. So why is it 30 or 40 years younger that we're dying in the United States? Well, there's a lot of reasons for that. But back to my case, when I started getting adjusted, I noticed my neck pain and my headaches were getting better. My sinus infections had gone away. And after 4 months of care, he re-x-rayed my neck and my discs had totally healed. So when he looked at my x-ray, the reason why I look like a 60-year-old, if you remember back to the x-ray discussion of your neck, if there's disc degeneration, that's usually a problem that's been there, 10, 15, 20 years. And so by all of the trauma that I'd had through football, created all this excessive wear and tear on my joints, making my neck look way older than it really was. And so some of you, when you see your x-rays, it's just an indication of exactly where you're at today. But I was re-x-rayed and my discs, once they totally healed, I was accepted to medical school at the time. And I knew that I wasn't going to be doing something that hadn't helped me at all in my 8 or 9 years of suffering from neck pain and headaches and sinus infections. And one of my favorite proverbs is that hope deferred makes the heart sick. That means if you've been diagnosed with depression or irritable bowel syndrome or ulcerative colitis or migraine headaches, whatever condition that it is, if you were labeled that from an authority figure like a doctor, what are the chances that you think that it's going to be better automatically? Most of you are going to say it will never get better, because usually they're saying, well, you have to take this medication for the rest of your life. And so me personally, I believe that our body is a self-healing, self-regulating organism, and that God created us to live to be at least 110 to 120 years old. So if that's the case, then what is going on in my body that's limiting its ability to heal? And so the reality of it is, Gray's Anatomy page 1 says the nervous system is the master control center of every muscle, every cell, and every organ of the body. And so what we're trying to explain is that just like me, when I was suffering, I suffered 20 years when I didn't need to. If someone would have told my parents about chiropractic care, I could have been saved from years and years and years of suffering. But now it's our job in our office to make sure that no one has to suffer like that. So right now, when we go over x-rays in just a minute, you're going to be able to see crystal clear where your problem areas are, but don't worry or don't freak out about that, because we just established why you're having these issues. So many people have no idea why they have this problem that they're experiencing. And so our team's whole mission, our team's whole goal is to make sure that you understand without a shadow of a doubt what is going on, and that chiropractic will be the answer for you. Because if you have proper structure, you will have proper function. If you have really bad structure, if your posture is not great, it's really hard, almost impossible for your body to have good function. And so everything that we do with the adjustments and with postural exercises, the goal of this is that with time and repetition, just like my body, just like all of my team members here, their bodies have healed with time and repetition. And with that, if you look at Forbes magazine, you ask people that retire, what is the number one regret that you have now that you're retired, looking back? And you know what they all say? Every single one of them, they have the car, they have the house, they have all the money to retire. They don't have their health to enjoy all the things they hoped that they were going to be able to do. So it's never a bad time to start investing, no matter how young you are or how old you are. The time is now to start saying, hey, well, I have these structural issues in my body that, of course, are creating these symptoms. And so from this point on, the goal is that if we start correcting that, just like with braces took time and repetition. And when you take the braces off, you have to wear a retainer to make sure that those teeth don't shift anymore. And so the goal of this is that we have your best interest in mind, and that your body is going to be able to heal. And more than anything, this is to encourage you. And our team is always going to encourage you in this journey, because this is difficult to say, hey, I'm going to make sure that my body is going to be able to overcome. And that takes time and repetition, but we're going to be with you every step of the way. And I'm going to be in just a minute to go over x-rays with you, and I can't wait to get your first adjustment, but we're looking forward to serving you and seeing great changes and victory in your health.